My name is Neerja Bhatla and I'm working as a professor in the Department of Obstetrics and Gynecology at the All India Institute of Medical Sciences at New Delhi in India. Our patients basically in the field of gynecology and more especially gynec-oncology, they usually present with the typical gynecological cancers, of which cervical cancer is an important one. It's the second most common after breast cancer. We have a large burden. It's almost a fifth of the world's burden. It's actually larger than the number of women who are now dying of maternal mortality. We don't have a systematic screening program, so we don't really have a lot of patients who come with the pre-invasive lesions, unfortunately. It's only when we step out to do these in some kind of a planned fashion that we are able to find some of these women and help them. What we've also done a lot of is to tell women in the cancer clinic that you can go back and be ambassadors. You've suffered this, but others don't need to. You can go back and tell people in your village, in your town, in your community. So I think one issue stems from the stigma that still remains around cervical cancer. Unfortunately, we haven't quite figured the right messaging to get it across, I think. Everyone knows a breast cancer survivor, but everyone does not know a cervical cancer survivor. I think one of the biggest problems is the resources. There are few doctors and paramedical people, and the emphasis is on curative. When you see a patient who actually already has a disease and suffering, then the tendency is to give that patient priority and not to the screening services. So this is why we do need to act upon it. We have the tools, we know how they work, we know which resource can handle which kind of a thing, and it's a shame if we don't use it to help the women who need it most. So it has to begin with us.